Anaphylaxis is a severe allergic reaction that needs to be treated right away. There are different causes of anaphylaxis. The immunologic mechanisms include IgE mediated, which include drugs, foods, hypermenopatra, latex. Non-IgE mediated include anaphylotoxins mediated, example, mismatched blood. The other causes include direct activation of the mast cells. The drugs such as opiates, tuberculare, dextran and radiocontrast dyes include in these. Other is mediators of the arachnoid acid metabolism by the use of aspirin and the NSAIDs. Other is the unknown mechanism by drugs such as the sulfides. The exercise-induced, food-dependent, cold-induced and idiopathic causes are also responsible for anaphylaxis. The onset of symptom of anaphylaxis usually starts from 5 minutes to around 30 minutes, but it can start from hours later as well. A more prolonged latent period has been thought to be associated with a more benign course. And talking about the mortality in anaphylaxis is due to the respiratory events in about 70% of the cases and cardiovascular events in about 24% of the patients. The symptoms of anaphylaxis include peripheral vasodilation due to the vascular permeability, bronchospasm, cardiac arrhythmias, and smooth muscle contractions. Pathophysiology. There's initial exposure to the allergen which sensitizes the mast cells, and then the antigen-specific IgE molecules attach to the high-affinity Fc receptor on the mast cell surface. Thereby, there is the cross-linking of the IgE molecule on the surface which causes the intracellular signaling pathway. Different inflammatory mediators are released upon the degranulation as well. The mediators involved include histamine, proteases, chemotactic factors, leukotrienes, prostaglandin D, and cytokines. The primary mediators are released before the degranulation, and the secondary mediators comes from the granules. Coming on to the treatment of anaphylaxis, epinephrine mixed in 1:1000 ratio subcutaneously or intramuscular is given. The dose is around 0.01 mg per kg. It is administered in the proximal extremity and could be repeated every 10 to 15 minutes. Epinephrine intravenously also could be given, which is used for anaphylactic shock not responding to the therapy. But close cardiac monitoring should be done because there is the chances of cardiac arrhythmias. Epinephrine also could be given via the endotracheal tube. The other treatment include diphenhydramine, which is the H1 antagonist. Around 1 to 2 mg per kg per dose or 5 mg per kg per day is divided into 6-hourly doses. The next is corticosteroid therapy. Hydrocortisone around 5 to 10 mg per kg per dose, stat intravenous or prednisolone 1 to 2 mg per kg per day could be given. H2 blockers or proton pump inhibitors should be given with the steroids. Thank you. Please do like, subscribe my channel and share this video.